Hello, my dear friend. How are you?
Hi, how are you doing? I'm very happy to meet you.
I'm so sorry for my late to be late, but I was on a consultation and then it was a little bit long.
I know, I know.
I'm so
Uh,
sorry. It's a pleasure for me to stay with you in London.
yes, of course. Here it's about 7:30 p.m. I'm not sure. In Brazil it's 4 p.m. Yes?
No, this is 3:30, 3:40 now.
Okay,
Yeah.
perfect, perfect. Okay,
How are
Professor
you doing, my
Mucci,
dear?
I'm fine, and we have followers, so it's okay to start the procedures. And I would like to ask you, please, have some introduction about yourself, your background, and like anything like a startup for the like more understanding about yourself and about the buffer.
Okay, my dear. Well, for those that they don't know me, I'm Dr. Múcio Porto from Brazil. I'm a plastic surgeon here in Brazil. I live in the capital of Brazil, Brasilia. I work here in Brasilia as a plastic surgeon, and I work too in Dubai for the last 9 years. And we work at AIG clinics in Dubai, in Jumeirah, in Dubai. And well, my life now is to be on the shuttle between Brasilia and Dubai. I'm a professional faculty member from of the American Academy of Aesthetic Medicine in Los Angeles, and we give some courses about aesthetic medicine all around the world. And that's why I met my dear friend, Dr. Ali Safari, in Dubai once, isn't it?
Yes, yes,
Yeah.
I believe it was about 7 years ago.
Yeah, maybe seven. I don't know why,
Yes,
but time is running so fast
yes,
today.
yes, it is.
After the pandemic, maybe the time is flying. It's
Yes, it is.
horrible.
I believe everything is changing the world because of the pandemic, like a lifestyle and the everything is changing in the world, and this is why we would like to go more fast because we had a lot of plans during the pandemic time.
Yeah, sure, absolutely. Yeah, especially talking about now because we
Yes.
are technically we are still on a pandemic situation in the world, but it's like it's over now because the
Yes.
world is returning to the normal routine. And you know something, Dr. Ellie, people are eager for knowledge for everything,
Yes.
and especially about our field, aesthetic, medical aesthetics,
Yes.
and aesthetic dermatology and plastic surgery. Today, people is trying to compensate the time we were um, stored, let's
Yes.
say, isn't it? What do you think about
Yes.
that?
Yes, it is. It's same in London because before the pandemic it was a little bit different, but during the pandemic I believe there is a little bit time to think about okay what's going and how is happening the aesthetic procedures, and we have a lot of inquiries after the pandemic for hair treatment, for skin treatment, because they have a lot of time to search about the static medicine. Maybe before, if I speak with someone, we have like aesthetic clinic, they are really not understanding what's going on aesthetic, because in London, a little bit different mentality. But after
In which
pandemic,
sense you mean?
yes, yes, but they are more happy with the skin clinic. Aesthetic procedure is a little bit different here. So during the pandemic, they are like doing a lot of research, and they have a lot of understanding about the procedures. And now it's good time for like a booming the market.
Absolutely, yes. And this is the best opportunity for those who don't know you yet. It's an opportunity for us to talk about your BAFA, the British Academy of Facial Aesthetics. This is a huge, a very important opportunity, a very important, a place for people to know about everything, what's going new in the world today. And the meeting in Istanbul in July, you are organizing it, and I'm so honored to be a part of that. I think it's one of the best places for people to see what's going on.
Yes.
Talking about new things, new techniques, new machines, and everything.
Yes, it is, and this is the first time happened from the UK. We have the internationally conferences because all the events is happen only in the UK, and we are the first company introducing the British accreditation as internationally.
Wow.
Special in Turkey. Maybe there is some stuff before in Dubai, but Turkey is the first time. And I have really good news for you and for any delegate who would like to join the conference. We have accreditation from BOPS, British
Wow.
Aesthetic Association. Yes.
This is
And
wonderful.
yes, this is. It's really, I really hard work with them because it's really hard to have this accreditation. And we have CPD international accreditation, which is like an international working, and the Royal College of Physicians. So
Wow.
these three top accreditation make really happy all the delegates all over the world.
Very good. You are fantastic. You are so incredible woman, because exactly at this point of the pandemic, you took the quick decision, and
Yes.
we are so excited. I talked to many friends here in Brazil, and many people is talking about your academy and your work and your decision about doing this meeting there in Istanbul. But tell me
Yes.
something about your work there in London. I can see still daylight.
Yes, it is. Yes, it is. It's still daylight. Yes, I have my own clinic in central London in Marylebone High Street, which is more skin dermatology. We are doing all injectables, all skin lasers, laser resurfacing, fractional laser, and RF needling, and more procedure in stem cell therapy. And my specialty is also exosome therapy for hair, for anyone who would like to don't do the surgery, or you prefer to have a surgery inside of the mesotherapy and the exosome and the stem cell. I'm doing really well.
Well, very good, very good.
Yes.
And what about now? Because you are going to the summertime now. It's not summer yet. This is springtime.
Yes.
And what do you think about what is the most frequent desire on your office? Talking about, let's talk about face, for
Yes,
example.
of course.
Skin condition, collagen production.
Yes. Yes,
What
you know,
people from London is asking about you now?
of course. You know, my area is more international area because Marylebone High Street is like a lot of nationalities and a lot of people we have in our area. But most common treatment and most popular one is the injectable filler and Botox. And in the other side, we have skin conditions like a pigment removal, or like an open pores, or like a skin rejuvenation, because my clinic is more anti-aging clinic, and most the clients is over 40 or 35. So it is like more anti-aging treatments.
Very good. Very good.
Yes.
And what do they think about body? for example. I know now in Europe you are going to the beaches and to the swimming pools and everything.
Yes.
Because as you know, here in Brazil, this is a fever. Everybody goes to the sun, everybody's wearing bikinis and bathrobes. And we are very, this is very common here for us, even in Dubai too, but especially here, about body cellulite and well, anyway, stillborn fat deposits. Is it a common complaint in London?
Okay, yes, of course. Here, as you know, we don't have a lot of sun, and most days we have like a rainy days in London. But regarding the body, yes, like skin tightening, for example, in the body area is really popular treatment because many people would like to go to the like Spain or Brazil or Portugal for like a summertime. So they would like to have treatment for the body, for cellulite, for skin tightening, or if they have some fat releasing, for example, mesotherapy, which is
Yeah,
really
yeah.
popular for body treatments. Yes.
Yeah, very good. You talked something about stem cells for skin rejuvenation.
Yes.
What do you think? What you use about? What kind of therapy you have?
Yes, for example, for hair treatment, we are offering a 12 session for with combination of a 4 session of exosome therapy, which is like a sterilized package with injection to the hair follicle, like a cell communication cell to cell, and we are offering.
Exosomes. You are talking about exosomes.
Yes, yes,
You know,
yes.
for those that are listening to us, exosomes is one of the brand new things in aesthetic medicine, aesthetic
Yes.
dermatology, isn't it?
Yes, it is. Yes.
Go
And
ahead. Sure.
yes, and we are offering 4 session exosome, 4 session stem cell, and 4 session mesotherapy because it's like helping to have good like a result for the hair rejuvenation. And I
Yeah.
have many cases for women and men and really good result because even if they did surgery, it's work before and after surgery. It's really good result.
Very good. And this is injected, is it?
Yes, yes.
Yeah.
I'm doing injection by mesogun because I have really good mesogun. Even for
Mhm.
hair is really good because injection by hand is a little bit difficult, but
Yes. Yeah.
mesogun is really
And it's not
easy.
precise,
Yes,
maybe.
it is.
With
Yes,
Mesogan, we can be more precise, talking about amount and the
yes,
deepness,
yes,
is
it
it?
is. And painless,
Very.
it's really good.
Absolutely, yes, yes. You know, Dr. Ali, here in Brazil, we have a small difficulty talking about new things. When we travel, we are on scientific meetings and we see the interesting things. Generally, it takes months or even 1 year for the Anvisa. Anvisa is the FDA in Brazil.
Mm,
And sometimes it's horrible because we are trying to have those things here and it takes time.
okay.
And but thanks God, even talking about the end of the pandemic, things is getting a little bit quicker. You understand?
Yes, yes,
And another point of view is the internet, the information, the news. We are globalized. So even for those guys in this department, governmental department, they are
yes,
changing their work, and it's quite a little bit quicker than in the past. So we can
yes.
have those things a little bit quicker than in the past.
Yes, yes, I believe it's same because as I told you, people has a lot of times to research, and I believe more online consultation was very common in the pandemic time. So it's really helpful. And for example, I have a clients, they are telling, okay, as I was in lockdown and in pandemic time, I had a time to think about myself, to think about, okay, what's going on, how is going my skin, and you know, everything about the like a rejuvenation or like an aesthetic procedure. So this is really good news for our world.
Yes, sure.
Yeah.
When you receive a patient asking you about their skin conditioning, um, you know, everybody knows today we still have chemical peels and
Yes,
biostimulators and exosomes
yes, it is.
and everything, and machines. For
Yes.
example, HIFU lasers and what else? Anyway, micro needling and those things. Generally, what you decide when your patient arrives at you, premenopausal woman, for example, asking you about the skin for trying to improve the skin, what do you think first?
Yes. You know, I believe myself, we need to have like a combination therapy for skin rejuvenation if we are offering for anyone, because in the skin conditions, we need to see first what's happening on the skin. And as soon as we realize, okay, this is the diagnosis, we need to, for example, do resurface treatment. In other side, we need to have something to collagen stimulation. We need to have
Sure.
something for hydration the skin. We need to have some like more like a peeling effect. So most treatments I'm offering for my clients in my clinic, it's like a package of like a different type of the treatments. Depend on the budget, depend on the time, depend on the, you know, what's
Sure.
the client's, you know, the popular side of the clients.
Yes, but about, for example, biostimulators, fillers, what you do first? Technologies for the skin, such as lasers and other LVDs, or
Yes.
you go to the biostimulators and fillers, for example.
No,
What you do first?
I'm starting with the laser resurface first because it's
Wow.
really good. I have area laser, which is really work on the skin conditions, and it's area laser. We are removing 20% of the skin, and as soon as the skin going to the rejuvenation process, we can offer them like a profilo. I'm not sure you have profilo in
Yes,
the.
I do. I love it. I knew
Oh,
it in
okay.
Dubai. And
Yes.
finally, thanks God, we have here in Brazil now. Oh,
I know, I know. And newly I'm offering Bellatora. It's from Mer's
oh,
company. It's really wonderful. It's reviving the skin, but both, you know, different because I'm not now. I don't want to like have any brand name here, but the Profilo is
yes.
very famous and everyone
Yeah.
happy with the Profilo brand. So
And
we
this
do.
is quite unique. This is a
Yes,
biorevitalizer.
yes, it
This is
is.
maybe the just one in this group, maybe.
Yes, it is. Yes. So we are offering a skin like a plumping with like any injection. And in the next step, I'm offering them like more needling plus mesotherapy or needling plus stem cell therapy because we need to have collagen stimulation, which is really good work for the clients.
Oh, very nice, very nice. And Botox. What about Botox injection?
Yes. Wow.
Is it still popular?
Yes, this
Because you
is the
know,
most.
yes, when I begin talking my lectures about botulinum toxin, I want to talk to the delegates that things that we still listen to in our office. We are on 2022, and even today, people are a little bit afraid about toxicity, about being a toxin, and especially coming from a bacteria. And some
Yes.
people are still a little bit afraid of botulinum toxin. Isn't it incredible? After so many years, we do that. What people in London talks to you about the fear, let's say,
Eh,
about botulinum toxin?
yeah, everyone knows Botox. If I'm
Sure.
telling I have a skin clinic or aesthetic clinic, maybe some cases they are not understanding, but most cases they are understanding filler and Botox. So it's
Yeah.
really popular treatment here. Yes.
Yeah, and in our lectures, I try to show to the delegates how to answer some special questions. For example, what happened to my last botulinum toxin injection? It's not as good as before. Do I have a resistance, or what's happening on? Do you listen to those complaints sometime?
Yes, you know, in my area, because many cases I'm using like a most natural type of the injection. Is not, I'm not going to make anyone like a mask face, because they would like to have
Good.
movement. Like
Yeah.
myself, I have movement, but I
Very
did
good
Botox.
Botox on you. Congrats. Did you
Yes,
do on yourself?
yes, a little bit.
Oh, I
I'm
want you
doing.
to do on my face. Your Botox is perfect.
Yes, we do offering like a very natural looking Botox. So just they are asking, okay, how is going after the Botox? Some of them it's like a first time, but most of them they did before, so they knows the treatment and the procedure. But by the rule here in London, we need to have consultation first, and
Yeah.
and we cannot do the same day treatment. They need to have 2-3 days to make decision. So
Yeah.
we need to do prescription and then come back to the clinic to do the treatment. So they have time to think after the consultation about the actual treatment. Are you happy to do exactly 100%? And in other case, because they are asking, yes, a lot of questions. What's happening? Some of them asking me, okay, can I go party after this?
Yeah. Yeah. Yeah.
Botox treatment? Can I do showering? Yes.
Yeah. Yeah. May I lie down or smile
Yes,
or talk?
yes, yes.
Yeah.
I had a case today. I did consultation with her because we did a Botox treatment for this lady like 3 weeks ago. And just a week later, she texts me, I can't see the result. I have a little bit heavy eye, but I can't see the result. Can I do like more treatment? Can I do something different? I said, yes, we will do. But 2 weeks later, you know, I cannot tell her. I explain her, okay, it's starting from 3 days later, you will see the most result within 2 weeks. But I cannot tell her I can't do it. I'm telling, okay, I will do. I will visit you. But 2 weeks later is the best time. And today she came to me. She was really happy. She told me, oh, you know, what about you did for me?
Yes. There's something magical called
Yes,
time.
yes, yes, it is. Yes.
Yeah.
Okay,
Something
okay.
new is coming here in Brazil. I want to talk to you. This is aesthetic gynecology.
Oh my
I don't
gosh.
know. Yes, this is so, it's quite brand new, let's say, especially in the people's knowledge. More and more, we are receiving girls and sometimes
Hmm.
guys talking about static andrology, let's say. But static gynecology is so strong and growing so fast.
Yes,
And yeah, especially for the quality of the skin on the genitalia
yes,
as a whole. And this is very interesting because people now, I compare sometimes this time and 5 years ago, for example.
oh my God.
People would like to complain about that, but they are very ashamed of it,
Yes.
very shy, very difficult. I remember a case. I have a very good patient. She's a very great friend of mine. She's a lovely girl, woman, let's say. I love to say my girls, even if they are 92 years old, but still girls in my mind. And she talked to me, Dr. Mochio, I want you to improve my genitalia, but I will talk you something. If you see there, I won't be back nevermore.
Oh my gosh.
I said, well, come on, I have all the time in the world, and I'll be here waiting for you. And last week she came and she
Okay.
said, well, finally I decided this is very important for me. I want to analyze. And we proposed some treatment, and I'm so happy for her because this is a very important point on women's lives.
Yes, it is.
Even for men, of course, because we are a whole pack. We are not just face and hands and legs, but sexuality is a very important part
Yes.
of our lives, isn't it?
Yes, you know, in my idea, it's like a second phase, because
Yes.
it's, you know, it's medical we are speaking now, but it's really important because it's helping to like improve the self-confidence for any woman. In London, there is many like treatments they are doing skin for face, like a dermatology or many treatments, but aesthetic gynecology is really baby here. And we are going to start some procedures maybe from September, which is called the Women Health Clinic. It's really amazing because we would like to invite you to join the team, and we will have, yes,
It will be
other...
an honor.
Sorry?
It will be an honor for me.
Yes, of course. Thank you. It's a great pleasure for us too, because we will have like a hormonal specialist, we will have women health, and we have someone to help for like a menopause, and it's really amazing procedures.
Yeah, very nice. And as we know, we have a baby now in Brazil. This is the Brazilian Academy of Aesthetic Medicine.
Yeah,
And together with our school, it's called Porto Medical School.
congratulations.
We are preparing a lot of, yes, we will do a lot of meetings and courses, and you are, of course, invited to come here to Brazil to
Good.
help us teaching people and doctors, of course. With your expertise, your knowledge, it will be an honor for us.
Good,
Have you been
good.
in Brazil before?
No, not yet, but I'm planning
No.
come to you, of course. It's my really
This is the
honor
time.
to.
Then our honor is ours.
Okay,
It will be a pleasure.
of course.
But look, I'm so excited to go to Istanbul for the BAFA meeting.
Okay, perfect.
As for our friends here in Instagram, BAFA means British Academy of Facial Aesthetics.
Yes.
And this is Dr. Ellie Saturday baby board.
Yes, yes.
And a very important organization for knowledge and meeting and teaching doctors on this wonderful world of aesthetics, medical aesthetics. Congratulations, my friend.
Thank you very much for your help and support. You assist me all the time. If I have any question, if I need any help, you support us. Thank you. And it's really big honor to be in the same team together. And regarding the BAFA, I would like to add something very important, because I had a lot of experience to hosting the congresses, workshops from like 7 years ago. But what's happening in BAFA, we create some special hands-on courses at the end of each day, which is from 4 to 7 p.m. It's really amazing for anyone who would like to touch the client, the models, and work on the model's face under supervision of the doctors, like professors, trainers. It's really amazing opportunity, because in most congresses it's a little bit different. Just we can see in the video, in live demo, that's all, and it's enough. But we create this opportunity in BAFA to anyone would like to do by hands-on courses.
Very good. And with your expertise in organizing things and with the patronage of British colleges, it will be very important for doctors to be there.
Okay, perfect. Thank you for everything, Professor Muti. I know you are very busy, but I'm really happy to meet you.
Me too. I'm so happy to stay with you this time today. I'm so honored. I'm so happy to talk to you.
Yeah.
I saw many friends here in Instagram. I want to thank everybody for being with us. And ladies and gentlemen, this is the great Dr. Ali Saturday from London, one of the most incredible organizers of medical meetings. My dear Marisa Dalbello, my great friend here. Thank you too, Marisa. And Dr.
Yeah.
Larry, I'm so happy for talking to you. Thank you so
Thank
very
you.
much for
Thank you,
the invitation.
everyone. And I hope to see
Have,
you in
thank you
Turkey.
so much. Have a very good weekend. Thank you
Thank
for
you. You
inviting me. I'm
too.
so
Thank
honored.
you. Thank you. Bye-bye.
Bye-bye, dear.
Bye-bye.